Are you struggling with pelvic pain and incontinence issues, and you're wondering, how did this start in the first place? What can I do about it? And who is it that can help me? Well, then you're in the right place. I'm Dr. Amy with Physical Therapy for Everybody, and I love helping women lead an active, healthy, and confident lifestyle, free from pain, medication, or surgery. And a lot of women, when they start suffering with incontinence issues, go to see their doctor, and the doctor starts talking about doing a surgery with a sling or a mesh, and they get freaked out. And if that's you, I completely understand where you are. That is super concerning to think about the fact of having to have surgery and what that's going to mean for you in the long term. So that's why we created this video today, is to talk to you about what you can do to start helping yourself right now. First, what started this problem? It depends on what phase of life you're in. That's most likely to indicate what started this problem. So if you're earlier in your years, like in your childbearing years, most often it's caused by having children. And there's stress that's put on our pelvic floor. Even if you have a C-section, during the pregnancy, stress is put on your pelvic floor. And often our bodies are able to deal with these things completely on their own. However, in today's society, we tend to want to get our bodies back quickly, and we push our bodies to do high levels of exercise or high levels of activity maybe before we were able. And a lot of people think, oh, you know, my mom or my grandma, they didn't need help with pelvic floor issues after they delivered, and they had, you know, multiple children, 5, 7, 9, maybe even more. However, how did they age through the years? Did they have to wear diapers? Did they have to have hip surgery? Did they lose their ability to walk without an assistive device? These are all signs that show up later on in the years of people who were not properly treated during their childbearing years. So if this is you, it's great because you can deal with this now and not have this problem follow you through your next transitions. Now, you may be someone who's a little bit older and you're going through the transition of menopause and you're wondering, why did this problem start all of a sudden? Well, when you're going through menopause, your pelvic floor composition changes a little bit. Throughout your body, your collagen is decreasing, and collagen is kind of the connective tissues that holds everything together. And that's not working quite as well as you're going through menopause, and definitely once you're in menopause. So for you ladies, we need to be more aware of the body changes that are happening as your hormones are changing. Either way, no matter what your age is, now is a great time to be dealing with this issue. Pelvic pain can not only be a pain, it can really interfere with our daily activities, especially with intimacy, which is very important in a relationship, to be able to be intimate with your partner. So it's important to deal with this issue. The other thing is that women will start to have incontinence issues. Often it will start with urination when you're coughing, sneezing, laughing, but that will progress over time if you don't deal with it now. And we don't want to see you having to wear a pad just to be able to leave the house in the long term. So dealing with this issue, if it's just starting for you and it's not too bad yet and you're not noticing it really interacting with your daily activities, now's the time to deal with it. If you have already started to notice that it is limiting your daily activities, making you feel uncomfortable or not wanting to participate in certain activities, then today is the day to deal with it. If you've already given up on certain activities because you're just decided you're not going to do that anymore because of this problem, there's still hope for you. You can still deal with this issue. What we need to do is figure out what is causing the pain in the first place, what is causing the incontinence issues in the first place, and it's a complicated journey to figure that out. The further along you are in the journey, the more complicated it is to figure out. But once you work with someone who's going to walk through that journey with you and really understand how this problem started in the first place, what it is that you need to do about it, and then helps you implement that plan, can make huge changes in your life. Now, the one thing I want to say here is if you think, oh, I just need to do more Kegel exercises, I'm here to tell you that is not a true answer. Kegel exercises don't help anyone. First thing, it's difficult to know if you're doing them correctly. And so many people have come into my clinic and told me they hate Kegels and they don't know if they're doing them correctly and they don't feel like they help anyway. Yes, they probably aren't helping. Why? Because your pelvic floor is probably tight. It is probably not weak. So many women are told that their pelvic floor is weak and that's why they're having this pelvic pain and that's why they're having these issues with incontinence. Ladies, I am here to tell you, more than likely, that is not the problem. More than likely, your problem is that you have a structural issue or your muscles are not working correctly or your pelvic floor is just tight. And when your pelvic floor is tight, think about it. If your muscles are squeezing with 100% of their effort and then you cough, sneeze, laugh, whatever, what are they supposed to do to help hold that urine inside? I mean, they're giving it all they got. What do you expect them to do about it? So it's going to be really hard for that pelvic floor to be able to work. What we need to do is teach that pelvic floor how to relax. And we need to ask that pelvic floor, why are you not relaxed in the first place? So probably some friends and neighbors in the area, it could be the hamstrings, it could be the glutes, it could be even the low back. It could be that you have an SI joint malalignment issue that's not allowing the pelvic floor to work correctly. That's why you need to be working with a specialist who can assess your entire body in a very holistic way to figure out what is going on with you specifically so that you're able to get the results you're looking for. If you have any further questions about this, please drop a comment below. We would love to make a video to help you and answer all of your questions. If you have any more questions specifically on incontinence, I encourage you to check out this video over here. Have a great day, everyone.